Memory, thought, emotion, our very breath, movement and nervous system all collide within one of the most unique and complex structures that exists on Earth, the mind. Today, we focus on the various facets of neurology. Welcome to Caribbean Medical TV. This is the Mind Map episode.
A neurologist is a specialist physician who deals with conditions affecting the nervous system. So that includes the central nervous system, which is the brain and the spinal cord, as well as your nerves and some muscle disorders as well. Some people, you need to make a distinction with a neurosurgeon. Sometimes we overlap, but obviously a neurosurgeon does surgical procedures.
Brain health is extremely important. Brain health is important not only for the patient, but for the family, and it affects our social, occupational, and emotional function. It's really important that if you think something's wrong, or if you think that something's not right by you, you get that assessed. We've got lots of locally, internationally trained individuals who can help. And as they say, the world is our oyster. Help is but a phone call or a Zoom call away.
The most common complaint in the neurology clinic, outpatient clinic, would be headaches, actually, very common. Most people who come to the clinic with headaches actually have migraines. Migraine headaches are very common. About 75% of the patients are women, 25% are men. There are other sorts of headaches that people complain about, which result from increased pressure in the brain, the so-called idiopathic intracranial hypertension, and we find that very common. Also more prevalent in women, and also more prevalent in individuals who are overweight and obese. Some of those lifestyle changes include not eating foods that may trigger migraines, not doing things that could trigger their migraines. Some people have dairy as a trigger for migraines, and it's a good idea to cut that out to see if it helps with the frequency and intensity of their headaches. And sometimes that's all they need. Many persons nowadays, they're so busy, they can't hydrate well enough during school or work. And so drinking a lot more water, being more deliberate about hydrating properly can help as well. Getting adequate sleep. Most of us, we come home from work and it's all about the devices, and up until bedtime, we're in the bed with the tablet, with the telephone, and it's really not good for quality sleep. So we need to get a good duration of sleep and high quality sleep, because sometimes we sleep for long and the quality is not that good at all. One of the things that's really important is to keep a headache diary. So whenever you have a headache, you write down, hey, this is the 3rd of March 2024. I'm having a headache. This is what it feels like. This is my typical headache. This is what I've eaten today. I don't think I hydrated well, so this may be a trigger. And then whenever the headache is over, you said this headache lasted such and such a time.
Thank you, Dr. Osborne, for these insights. And now, a question from one of our viewers. What exactly is the difference between a CT scan and an MRI?
The way I like to put it is that the CT scan, the advantages are is that it's quick, it's generally much more accessible than an MRI, and it's more affordable. Some conditions, many conditions, that type of imaging is good enough. But really, looking at a CT scan, it's like looking at a black and white movie. Versus an MRI is like seeing something in high-def color. You see a lot more, and so sometimes it is necessary to get an MRI because you need that more detail in order to make the diagnosis. The MRIs tend to be more expensive, and those studies take longer.
Joining us now is Dr. Cheriann Catwell to discuss total mental health within the context of our busy lifestyle and increasing environmental challenges. This is Caribbean Medical TV's Meditative Minute.
Just like physical illness, what we recommend is prevention. So in order to have good mental well-being, We usually recommend exercise, relaxation, taking breaks, setting boundaries. It's okay to be selfish. It is okay to tell persons no. If you're at work, take a break. When you work for at least 2 to 3 hours, take at least a 10-15-minute break. And that doesn't mean going outside. It just means sitting down, going for a walk in the office, having a bottle of water, just relaxing. And these are all tips which are important and necessary to sustain your mental well-being and have good mental health. When persons may have mental health challenges, what I found was that it usually starts with subtle symptoms. What I would suggest is that if you see persons or your family members or loved ones becoming a bit withdrawn, they may not be interacting and communicating as much as possible. That is a change in how they used to communicate. They might be going through a challenge. Sometimes persons may become more easily frustrated or get upset about things that they wouldn't usually bother about or things that wouldn't usually worry them. Sometimes you may need to ask them, is everything okay? How are you feeling? Just simple questions like that, screening questions, go a long way in detecting if persons have any mental health challenges. We did also a lot of psychological first aid to help persons cope and manage. We went to different workplaces to sensitize the public, the employers, about what to look for, because we know the importance of burnout in certain organizations, and we try to sensitize the managers and the supervisors to give persons sometimes like a mental health day, or we encourage frequent breaks at work, because we know burnout leads to increased levels of anxiety and depression and difficulty sleeping.
Republic Bank is more than just a financial institution. We've been a steadfast partner in the communities we serve, investing in their future through our Power to Make a Difference program for more than 2 decades. Our aim is to drive meaningful change, expand our sustainable footprint, and ultimately build more resilient communities. Our footprint spans 16 territories across the Caribbean, South America, and West Africa. We understand that true success is built on the strength of our communities. That's why we're committed to making a lasting, positive impact. This is why the Power to Make a Difference isn't just about funding. It's about active participation. It's about providing crucial support and guidance to our valued non-governmental partners, empowering them to achieve the United Nations Sustainable Development Goals. By working together, we can create a movement of positivity that resonates throughout the territories in which we operate.
Welcome back to the Mind Map episode. Now we journey over to Barbados, where Dr. Ambrose Ramsay joins us to discuss geriatric medicine.
As people get older, you, in most cases, have been living either healthy with no chronic illnesses, or in many cases, you've been living for many years with chronic illnesses. This will be the diabetes, the hypertension, in particular, that we hear of every day. And what happens is, as you get older, you tend to see the complications associated with having these illnesses for many years. So you see people who are developing, they might have had a stroke, they develop heart disease, and they also start to suffer weight-related issues like arthritis. And so in many cases, older people have multiple medical conditions. Nowadays, it's referred to as multiple comorbidities. And hence, it is difficult, or it's complex in managing one chronic illness. There are several medications and lifestyles necessary to manage hypertension, to manage diabetes. And when you combine that in an older person, it becomes quite difficult to manage, and one has to make decisions as to what really matters most to the patient.
many a times we think someone has dementia, but it's an unfair assessment because they may be experiencing something else at the time. Chronic pain. You can't expect someone with chronic pain to perform as robustly on any sort of assessment that a normal person would have. Medications. So some medications, in the elderly especially, can cause a decline in cognitive function.
When our family member, for example, is not remembering where they are, they lose their place in their home, for example, unable to find the bathroom or the kitchen, so their wayfinding is gone. That is one of those symptoms. Repeating stories like obsessively. We all do some of that as we age, but then we can start telling that this person just told the story a few minutes before, and then we start wondering. It's a good time to start wondering. When we get lost in time and space, I would say there would be a really great idea for a family supporting someone that does have dementia to gain as many skills as they can, because none of us, many times I would say to family members, we think that if we're the husband or the wife or the child, that we will be able to take this person to the end on our own. And that is almost impossible without losing yourself completely. The most common misconceptions about dementia is that, well, for one thing, that it comes with old age. We know many people that are in their late 90s or early 100s that they are slow in processing, but they still know what is going on. So it is not a necessary side effect of aging.
Alzheimer's is a type of dementia. Dementia is an umbrella syndrome which encompasses many different disorders. So there are many causes of dementia. Alzheimer's is the most common form of dementia. Studies done in North America, UK, and they report that Alzheimer's takes up about maybe 60 to 70% of the dementias, so it's the most common. However, the other types, like vascular dementia, is associated with high blood pressure. People who would have had maybe a stroke in the past, or who might have had, let's say, valvular heart disease, a reason for damage to the brain as a result of vascular pathology. So a problem within the blood vessel then affecting the brain causes vascular dementia. And our populations in the Caribbean, in Barbados and the Caribbean, we have a relatively high prevalence of diabetes and high blood pressure. And those two illnesses do increase the risk for vascular dementia. So the points that I would like to make would be, number one, you need to pay attention to your loved ones. Once you identify the early signs, memory loss, it's important then that you have that person assessed. So take them to the doctor and have them assessed, particularly looking to see why the person is losing their memory. And the doctor that you can use is a neurologist. If you don't have a geriatrician in your area, you can use a neurologist. There are general practitioners as well, I'm sure, in every island who are familiar with this illness through training, and they know what to look for, and they can at least make the initial contact with that general practitioner, who can refer to the neurologist, to the psychiatrist, if necessary, to help to make the diagnosis, because making the diagnosis is important.
Thank you, Dr. Ambrose. We'll continue with more on geriatric medicine right after this.
I am Navin Dukran, CEO of Eximbank, and we understand the power, impact, and transformative potential each citizen has. Our vision is to transform the domestic export environment and be the preferred trade finance service provider, creating value and making a difference in our national economy. Here at Eximbank, we recognize that we operate within a complex rhythm that exists in our social structures and biodiversity. It is written in every community and generation. So let us work together to facilitate growth and expansion, creating sustainable employment while respecting our planet and our environment. Our nation's strength lies in the people and the generations to come from the work we do today. The journey is before us and the challenge is here. The need is now. We are but a reflection of the world we live in. So let's work together to make it a better, healthier, and more sustainable one.
This is Caribbean Medical TV as we continue our focus on neurology, the mind map.
So when we get to the older populations, we're seeing the things like Alzheimer's, dementia, those kind of things. And the fact that older people have their unique struggles that sometimes go unnoticed as well. Like, we see depression in older people and people are just like, well, they just change after they get older, you know? Or you're seeing Alzheimer's and people, again, because of the stigma, they don't want to say their family member has a mental illness, right? So she's fine, she's just forgetting a little thing, right? So we don't put her on medication or we don't put him on medication and they don't get the help that they need necessarily. Or they're just going through life changes where their friends are dying, they're burying people, you know, everything is changing, they're not adapting to the world, they can't go on social media, they can't use the devices, and so they get a bit left behind sometimes. So that's just generally some of the issues that we're seeing.
So many times, you know, when patients come to clinic and, you know, I kind of wrap up the clinic encounter, just before finishing, I look at the caretaker and say, how are you doing? How are you managing with all of this? And they may break down and say, listen, doc, this is just a lot for me. I can't. They need to take care of themselves too in order to be able to take care of their loved one. And we have this thing in the Caribbean where we don't want to put our parents, our grandparents, our uncle in a nursing home, but that indeed may be the best thing. I highly recommend that if there's an issue with caretaker burden, that a nursing home should be considered. Sometimes the problem with that is finances. Sometimes you can hire someone to come in and take care of the loved one. It's just kind of tough all around, you know. In the Caribbean, most of us are in a low resource environment, so it's a bit tough, and this is where, you know, maybe governments can help.
Many people, their churches also have, you know, they have programs where, you know, churchgoers come over to the home and visit you, maybe give you a little help with the shopping. And I think, you know, it's to keep as active as you can and continue doing the things you enjoy for as long as you can. And, you know, within the home, you know, as things progress, you know, it's important, it's difficult on the families, it requires a lot of patience, you know, to still include their family members in the activities of the household and what they can do. So helping lay the table, you know, putting away the dishes.
Next up, there are reversible causes of dementia. And it's important when someone comes to the clinic to ensure that the person does not have something that's reversible, such as a vitamin deficiency, like a vitamin B12 deficiency. That's one of the common causes of a reversible dementia. Someone who may be a vegan who's not supplementing vitamin B12 can have a vitamin B12 deficiency. Anyone with poor nutrition can have a vitamin B12 deficiency. So, persons with thyroid disorders can develop dementia or dementia-like syndrome, so to speak. So it's important to also check the thyroid, although the person may not present with other symptoms of thyroid disease.
As our populations age in the Caribbean, you're going to see a lot more of it. We need to prepare. We need to prepare. If you do not prepare properly, we're going to find ourselves in a situation where you're going to have older persons out there who aren't able to care for themselves, and there's no one really taking care of them. They will be at risk for predators. People are going to take their money. People are going to try to take their property, and it's happening. The Alzheimer's Disease International has been encouraging governments around the world to do is to develop national dementia plans. You know, different countries, of course, based on their demographics, will probably see it more urgent than others, but it's a way of identifying the illness early, putting things in place to protect the individuals and helping them to live a useful and productive life. And happy life, because like any other individual who has their mind intact, these individuals too want to live, you know, good quality life.
Neurological disorders come in different forms. Now, we look into the variances of each, such as epilepsy and seizures.
Because I still think there is some stigma attached to epilepsy. But, you know, I think it's definitely all neurological conditions are a lot more manageable now than ever before. You know, the number of medications we have available to us with better side effect profiles. And, you know, it's no longer the case that because you have a certain neurological condition that you can't have children, that you can't work, that you'll never drive again. That's not true. We can control these things a lot better now, and you can do all of those things. Epilepsy, really what it is, it's abnormal electrical activity in the brain. So the neurons in your brain, they communicate with a form of electrical activity. So it's when you have an overactivity of that you get bursts of electrical activity that cause seizures. And the way the seizures manifest themselves is based on which part of the brain that abnormal activity is going on in. So again, if it starts in a spot here on the left, the seizure may start with some shaking on the opposite side. Those are called focal seizures. There's also something called generalized seizures, where you have abnormal activity on both sides of the brain. And that's the one that most people know, fits.
So whenever a patient comes to the emergency room or to your office and they say, listen, I've had a seizure, you need to determine as a physician, based on your history taken, whether or not this is a provoked seizure from a drug, a medication withdrawal, or some of the sort, or if it's epilepsy. Okay? So epilepsy is fairly common in most populations. About 1% of any population has epilepsy, and there are many reasons. So you can have structural lesions like a stroke. The most common cause of epilepsy in patients over 65 is actually strokes. You can get epilepsy as a result of neurodegeneration. So persons with dementia are at risk for having epilepsy. You can have birth injuries that can result in epilepsy. You can have just genetics, your genetic makeup can put you at higher risk for having epilepsy. You can have malformations of the brain, infections, autoimmune issues. All of these are causes of epilepsy. Persons with epilepsy, is very common for them to have depression and anxiety as well. And it's important to identify this and to treat it to improve the patient's quality of life. After all, we're doctors, we want to treat diseases, but overall what we're trying to do is to improve the patient's quality of life. We want them to live a good, full life. So there are many things that cause seizure. The most common cause of seizure that we see in the ER is someone who withdraws their medication. So they're on anti-epileptic drugs or anti-seizure medications, and for whatever reason they ran out of the medication, they don't feel like taking it, and they stop the meds and they have withdrawal seizures. Low glucose can cause seizures. High glucose as well can cause seizures, but we mostly see it with the hypoglycemic, so the diabetics who have a low blood sugar, they can come in with seizures. Sometimes it can be from drugs. That's one cause of seizure. So cocaine is a common cause of seizures, but any other illicit drug can actually result in seizures.
Over the past few years, in collaboration with our colleagues, we've really moved forward together as one unit in the Caribbean. Jamaica, Barbados, Trinidad, and many of the other islands have collaborated, and we've moved forward with advanced medications that we've been able to procure locally. And for some patients, we've been able to introduce some surgical modalities. In some instances, we've been able to achieve curative surgeries, whereby we may see a lesion in the brain and have that removed. Or in some instances, we've been able to do procedures such as temporal lobectomies. And in some instances, we've done what we term as palliative surgeries, whereby we try to reduce the burden of seizures and improve the quality of lives of patients, such as vagal nerve stimulation. This is really a team effort and has involved neurology, neurosurgery, neuropsychology, and I'm very pleased to say that over the past 5 to 6 years, we've seen a growing numbers in our community where we have locally and internationally trained subspecialists who've really come together to form part of that comprehensive epilepsy team.
A video is very helpful, capturing the seizure, because people are all very nervous when someone near them is having a seizure. You may not remember everything that you saw. If you have the frame of mind to pull out your phone and take a video, that would be very helpful. The important thing is to keep them safe. So that usually means lowering them to the floor, turning them on the side. Don't put anything in their mouth. I think in the past, some folks thought, well, let's put a spoon or something in their mouth, but you don't want to put anything in their mouth because they might choke. The best thing is lower to the floor, turn them to their side, and just try to keep them safe. General rule of thumb, if the seizure doesn't stop within 5 minutes, for sure you need to call an ambulance. If you're coming to me with a referral of seizures and possibly epilepsy, you should definitely have your list. I always love it when patients come in with a long paper, and I love it when they have a very detailed account of what they experienced. I want to know exactly everything you felt. Where were you when it happened? The date it happened? How long did it last? Everything you remember. It's very helpful, especially in seizures, because there's certain features that let us know that yes, this is a seizure, and it can even help us localize where exactly the seizure is coming from in your brain. And so the other thing is, I would say, is if possible, bring someone along with you, or have someone available on the phone. Let them know you're coming to see me, because a witnessed account is also very important. Because, like I said, in many seizures, you lose consciousness. So you can tell me so much that you remember, but you won't remember everything. You won't remember while you're having the seizure and you've lost consciousness, and you probably won't remember for a little bit afterwards, because most people are very confused or very drowsy after the seizure. And in your list, also have your questions, any questions you have at all. It's best to come to the specialist clinic prepared with all your questions.
Subscribe to our YouTube channel for up-to-date episodes and behind-the-scenes content. We hope you've enjoyed today's episode, and we look forward to seeing you on the next edition of Caribbean Medical TV.